Hi, welcome to Health Place. In this video, you will learn about leukemia and its symptoms, the risk factors and also when you should talk to your doctor. For more videos on healthy living, kindly subscribe and enable the notification bell. Leukemia is a malignancy that affects blood cells that are still growing. Abnormal white blood cells are created in persons with leukemia, impairing the body's ability to make healthy new blood cells and respond effectively to infections. Leukemia types can be classified in a variety of ways. These can include things like how quickly it's progressing and which cells are affected. Adults with leukemia may experience symptoms that are similar to those of other illnesses, such as exhaustion and fever. As a result, leukemia might be difficult to detect at times. Keep watching to learn about the many symptoms of leukemia. What are the most common signs of leukemia in adults? Some of the most common leukemia symptoms that adults experience prior to diagnosis include 1. Fatigue. Fatigue is a severe degree of exhaustion. We've all been tired at some point in our lives. However, exhaustion caused by leukemia or other types of cancer is chronic and might interfere with daily tasks. Leukemia can make it difficult for the body to manufacture new blood cells. Red blood cells, for example, are crucial for transporting oxygen throughout the body. Anemia, or a lack of red blood cells, is a common cause of fatigue in people with leukemia. Fatigue arises in this scenario because the body's organs and tissues aren't getting enough oxygen to function properly. 2. Fever and night sweats. Fever, or a body temperature that is higher than normal, is common in people with leukemia. This can also cause night sweats, which are periods of visible sweating while sleeping. Fever is one of the body's defense mechanisms against infection, therefore it's probable that it's a way for the body to try to kill leukemia cells. Leukemia increases the chance of infection, which might result in a fever and night sweats. 3. Easy bruising or bleeding. Low amounts of platelets, which are necessary for blood clotting, can be a side effect of leukemia. As a result, some patients with leukemia may suffer the following symptoms: easy bruising or bleeding, bleeding gums, frequent nosebleeds, heavy menstrual periods, small red or purple spots on the skin. 4. Aching in bones or joints. Leukemia cells can develop up in joints or at the surface of the bone in some cases. When these cells pile up in certain locations, the pressure might build up, resulting in agonizing pain. 5. Frequent infections. Leukemia can reduce the number of healthy white blood cells in the body. Because these cells are necessary for infection response, a person with leukemia may experience more frequent or recurring infections. 6. Unexplained weight loss. If you've lost weight without trying, it could be a sign of a serious health problem, such as leukemia. This could be due to a number of factors. For starters, producing a large number of leukemia cells can consume energy that would otherwise be stored as fat. Second, leukemia can cause appetite loss, causing you to eat less than usual. If you've lost more than 5% of your body weight in 6 months to a year, you should consult with a healthcare professional. 7. Shortness of breath. Shortness of breath is another leukemia symptom that's related to anemia. Since anemia causes a shortage of red blood cells, less oxygen is being carried throughout the body. This can lead to shortness of breath. It's your body's way of trying to take enough oxygen into the lungs. Additional symptoms. Some additional symptoms that an adult with leukemia may experience include pale skin, feeling dizzy or lightheaded, loss of appetite, swollen lymph nodes, headaches, enlarged liver or spleen, abdominal discomfort, nausea or vomiting and numbness. Are there certain symptoms that women should know? In addition to the symptoms mentioned so far, there are a few others that women should be aware of. If leukemia is a concern, any of these symptoms should be evaluated by a healthcare professional. People with leukemia may bleed more easily because the disease affects platelet production. Women with leukemia may experience the following symptoms: heavier menstrual periods than normal, and significant spotting between periods. Additionally, it's important to note that some leukemia symptoms can be similar to those of menopause. These can include things like night sweats, hot flashes and fatigue. Pregnancy can also mask some of the potential symptoms of leukemia. For example, fatigue is very common during pregnancy but can also sometimes be a possible sign of leukemia. What are the risk factors for developing leukemia as an adult? There are several risk factors that are linked to developing leukemia. These can include 1. Gender. Males are more likely to develop leukemia than females. 2. Age. The risk of getting some types of leukemia increases as a person gets older. 3. Family history. Having a close family member, such as a parent or sibling, with leukemia can increase a person's risk. 4. Previous cancer treatment. It's possible that people who've had chemotherapy or radiation therapy for another type of cancer can be at an increased risk of developing leukemia. 5. Smoking. Smoking cigarettes can be a risk factor for developing AML. 6. Environmental exposures. Exposure to radiation or industrial chemicals like benzene raises a person's risk of leukemia. 7. Certain blood disorders. Certain types of blood disorders, such as myelodysplastic syndromes, can raise your leukemia risk. 8. Some genetic disorders. Having some types of genetic disorders, such as Down syndrome or Fanconi syndrome, can increase the risk of leukemia. When to see a doctor. Leukemia symptoms may be comparable to other more frequent diseases of health. Because of this, it can sometimes be difficult to know when to schedule a medical appointment. Generally speaking, it's a good idea to talk to a healthcare professional if you notice concerning symptoms that could indicate leukemia, particularly if you have any of the risk factors listed so far. Here are some signs that it could be time to schedule a medical appointment. 1. Persistent symptoms. Some symptoms of leukemia can be persistent, meaning that they don't really go away or recur frequently. Some examples include fatigue, shortness of breath, and infections. 2. Unexplained symptoms. Several leukemia symptoms can happen without an obvious cause or explanation. Examples include things like fever, night sweats, and unintended weight loss. 3. New changes. It's possible that leukemia can cause new, noticeable changes in a person's body. Examples include easy bruising, heavier periods in people who have vaginas, or swollen lymph nodes. A healthcare professional can perform a physical examination and blood tests to help get an idea of what may be causing your symptoms. If leukemia is suspected, they'll order additional tests such as a bone marrow biopsy. The takeaway. There are different types of leukemia. Most of them are more common in older adults than they are in younger individuals. However, some types of leukemia are more common in children and young adults. Many of the symptoms of leukemia are similar to those of other health conditions, like fatigue, fever, and shortness of breath. It's also possible that symptoms can vary based on the type of leukemia or your age. Talk with a healthcare professional if you have symptoms that are consistent with leukemia, especially if they're persistent or can't be explained by another condition. Specific tests can be done to find out what may be causing them.